infertility in men can manifest through various signs and symptoms. So in this video, I'll be showing you signs and symptoms that infertile man can exhibit and just an eye diagnosis of infertile man when you see it. Then stay tuned. The first one is hormonal imbalance, changes in sexual desire, that is a decrease in libido, can be an indicative of a hormonal issue that can affect the man's fertility. The man does not have interest in sex is a sign. The second one is gynecomastia, that is enlarged breast tissue, which can result from hormonal imbalances, particularly when there is excess estrogen, that is the female hormone, in the man's body, and low testosterone hormone. The next one is physical and sexual function. When the man has erectile dysfunction, that is difficulty achieving an erection, can be linked to infertility. When the man has low sperm count, that is any sperm that is fewer than 15 million sperm per release. The next one is azoospermia. When a man has complete absence of sperm in their ejaculates. One is abnormal sperm morphology and motility. Sperm that are abnormally shaped or do not move properly can hinder fertility. The next one is pain and swelling in the testicles. If there is an underlying condition such as infections or varicocele, that is enlarged veins in the scrotum, it can lead to this. Then the next thing I'm about to talk about is genetic and congenital conditions that can affect fertility. One is undescended testis. When the testis did not descend into the scrotum, this happens during childhood, and if not corrected, can lead to infertility. The next one is Klinefelter syndrome. This is a genetic condition where a man has an extra X chromosome, often leading to reduced testosterone levels and leading to infertility. It can make the man to look like a woman. The next one is lifestyle and health factors. What are lifestyle factors that can affect your fertility? One is being obese, having excess weight, that is chronic. Another one is chronic illness, such as diabetes, kidney, cystic fibrosis. Another one is infection, if you have infection. Then medical history. If you have had surgery and trauma, it can affect fertility, especially when it is in the pelvic area. Another one is cancer treatment. If you're on chemotherapy or radiation, it affects the sperm. Then the next one I'm talking about is diagnosis. How can you diagnose this? By going for semen analysis to evaluate the sperm count, motility, and morphology. You can go to hormonal tests to check your testosterone, LH, and FSH. And the rest, you can go for ultrasound scan to see the scrotum and the testicles. Then physical exam to assess whether there is any changes in the reproductive organ that can lead to reproductive or infertility issues. So if you are a man and you are experiencing all these symptoms, or anyone you know that is experiencing all these symptoms, the best thing you can do for them is to advise them to visit a healthcare professional